it's amazing how many people that are in a terminal situation can reverse it if they take control of their own, issues. More people should do it. But we give it all up to MDs, the right prescriptions for drugs from drug companies that own them. Over a period of 8 months, January 7th into August of 1995, I did a total of 2 weeks of full doses of interferon and 8 weeks of half doses. Now these were all broken up over a period of 8 months. After the first shot, the doctor said, well, why don't you try a half a dose? So I did, and I still have some of the boxes, and on the brochure, it says in the brochure, with Schering-Plow's name on it, that this product is 83% effective. And that was the original alpha interferon alpha 2B, which is exactly the same drug that is in PEG-Intron. It just has a time release factor built in it. So it's the same drug, but with a time release factor, it's the quality of life during and after treatment goes down significantly. And you can read that on the front page of my website in the CBER report. Now, I had a rough time with that drug. I mean, extremely rough time. I was sick. I was wound up in a fetal position for a lot of that 8 months. The first shot, I went back to the doctor, and he opened up this big closet door, and he put some pills in a bag, little boxes of samples, and he handed it to me, and he said, here, go home and take these. I opened up the bag, and it was a bag full of 8 little boxes of Tylenol. And I guarantee you, every Tylenol pill you take damages your liver. It was just hilarious. I didn't think it was very funny at the time, but that's modern medicine for you. Melody Beatty likes to tell me that if people do plenty of research, they can make a decision on this issue. However, I don't feel that that's an accurate assessment of the situation. The side effects, the lifelong, seriously damaging, common side effects of interferon are so bad that it should not be considered for the treatment of anything. Doctors get paid from $10,000 to 6 figures, which is over $100,000, to prescribe interferon for the treatment of hepatitis C. I keep a copy of it right here at my desk.
Where's the headline?
Front page. As doctor writes prescription, drug company writes a check. Read it. Most of the emails that I get today are people who went to the website interferon.ws and wrote the horror stories of things that have happened to them, and how do they keep wanting to know, what do I do, what do I do? And it's been a long time developing what people need to do. And what I'm seeing is a hyssop fast is good. CNS, NatCell CNS, and I'm learning why it works. It works great because it's feeding the brain. CNS means central nervous system and brain. And when people have side effects from interferon, like for instance, when I took it, this left knee would burn like somebody had a giant torch on it. Fortunately, that's gone away. But that knee wasn't really hurting. It's brain damage that causes that. Most of the long-term side effects from interferon are from brain damage. So it's very difficult to repair the brain. You need to clean the body. You need to do cleanse, hyssop fast. And you need to use NatCell CNS. And there's a few other things I'm working on. Bio-omega-3 are a good fish oil. Those are even being used by medical doctors and psychiatrists now because of the mental elevation that they give you. You're not going to experience this on one pill or one bottle. It takes 20, 30 days to start to work right. There's vitamin B complex therapy works fairly well. There's a few other things that I'm working on. I hope to by year's end have a program for this, because right now I'm assessing how each thing works in all the people who use it. And once I have it figured out that I can say, okay, this is going to help most people the most, then I'll have a program for it. Because these are people that are hurting. I mean, hurting bad. Interferon causes most people to have at least a slight to a severe amount of social problems. They won't go into crowds. They avoid people, and it's far worse than most people think. A lot of people that use interferon end up divorced, and I have wives and husbands call and email and tell me how horrible it is and what happened to my wife or my husband. They're not the same person, and universally almost everyone says, I would rather have hepatitis C than to have ever used that drug. And one of the things that hurts me the most is these people who I talk to or email with and tell them, don't use it. And they go ahead and use it, and they write me these stories, and they call me in tears. They lose their house in foreclosure. Their wife leaves them. Their kids won't talk to them. They lose their job. It is a plague on our society, and nobody is looking. Nobody is listening, and it's just swept under the rug. It is hell on earth. I challenge anyone to come sit in my office for a day and answer the phone and have a different opinion. It is a bad drug. You don't have to be a doctor to know it. In fact, it appears as though they're the ones that really don't care that much about it. But it's a bad drug. It kills people. It causes people to kill themselves, to kill other people. It also has numerous lifelong side effects. It causes autoimmune disease, arthritis, lupus. It causes different types of cancers. It causes one of the things that really does great is fry thyroids. A lot of people with hepatitis C already have a little thyroid problem, which, by the way, avoid soy. I know soy is supposed to be great, but soy causes problems in thyroids. But interferon, God, I don't know how many clients I have that have thyroid problems. I mean, they have no thyroid. They have all kinds of thyroid problems, which they did not have before they used interferon. And even if they don't have hepatitis C anymore, which is only a few people, their life is much worse. Quiet, dog. Interferon, there's a study, a CBER report, which is an arm of the FDA that evaluates this type of drug for sale. And some people say, Lloyd, that's an old study. I think it's 2001. It's the largest study ever done on pegylated interferon. And if you think it's old, just keep one thing in mind. It's the same drug. It's the same disease. So nothing's changed. It's much easier to live with hepatitis C than it is to live after interferon use. Go to interferon.ws and read. Those are real humans. Those are their words.
Has there been another study since then?
It tells about these studies in the New York Times article that was June 27th, 2004. The studies they're not real studies. They just call them studies. They do that to generate people's interest, to generate money. They're not. Most studies are not really studies. I mean, I have had a woman call me in the middle of the night and tell me my husband just shot the family dog because he was on interferon. I mean, that's a real thing that happened. It's horrid.